So we'll kick off now, if that's okay. So a huge welcome to everybody to this webinar this morning on evidencing impact on PPI. So this is hosted by the PPI Ignite offices at UCD and RCSI, and we've been working together on a series of webinars relating to PPI and preclinical research, because it's an area that is maybe less well developed than other areas of patient and public involvement. And it's something that both of our offices have a particular interest and experience in. So really pleased you can join us today. I suppose just to give you an overview of the session, so I'm just going to go through some introductions and housekeeping, and then we'll have a presentation from Dr. Emmy Racine on evaluating public and patient involvement, and then Dr. Dorris will talk us through an example which will help us put into context PPI and evaluating PPI in preclinical research. Then we are delighted to have some reflections and questions from Ciaran McCarthy, who's a PPI contributor with experience with preclinical research project. And we will be delighted to take any questions that you have as well. So I suppose just to give you just some background for those of you who are not familiar, as I mentioned, Emma and I are based at PPI Ignite offices at RCSI and UCD, but we are delighted to welcome colleagues from other offices. So Martha's here from Norway, and we work across 7 universities collaboratively to try and grow and develop PPI across Ireland. So really delighted to have funding from the HRP and the IRC via the PPI Ignite office to support all this work that we do. So I suppose I've mentioned who you're going to hear from. So my name is Michelle, and I'm the PPI Ignite site lead at RCSI, and Emma and Emmy and Ciaran will introduce themselves as we go through. So if you have any questions or if you have any comments, please do feel free to use the chat box. And we will have plenty of time for questions and answers at the end, so you can raise your hand and ask. We'd love to hear from you. But do please feel free to use the chat box in the meantime, because I'll be keeping an eye on it as we go through. So I suppose without further ado, I will play, because Emmy, as she'll explain herself, is gone on mat leave today. So she pre-recorded this session for us. So we'll play through Emmy's session, and then after that, we will hear from Emma and Ciaran and then have questions and answers. So please do use the chat box. Questions, comments, welcome. We'd love to keep this as interactive as possible. So I'm just going to go ahead now and play Emmy's session.
Hi everyone, my name is Emmy Racine. I'm the Programme Manager for PPI Ignite Network at UCC. I'm very sorry I can't be with you live for today's session, so I'm going to have to record this ahead of time. Today is actually the last day before I finish up for maternity leave, hence why I can't be with you live. But I'll do this about 20 minutes on evaluating patient and public involvement. I think this next quote is from Antoine Boivin, who's published a lot on PPI evaluation. And he says, if we are serious about involvement, we need to be equally serious about evaluation. And I think that's very much where we are now today when it comes to PPI evaluation. It's the kind of generally accepted opinion, I suppose, is that PPI evaluation is really important. But I was reflecting as I was putting these slides together, I was kind of reflecting on the last 5, 6, 7, 8 years and how we've come to this point. And I think it's not always been the case that everyone is in agreement that PPI evaluation is important. And a number of years ago, I was actually at a conference on PPI evaluation, and it was still quite at that time, quite, I'd say controversial is a bit extreme, but you know, there were plenty of people at that conference that kind of felt that, you know, PPI is a really important component of research. PPI contributors should be integral to a research team, just like the other experts, whether that's statisticians or health economists or, you know, the different stakeholders involved. And And we don't necessarily look to evaluate the statistician's input on a project, or we don't evaluate the health economist's input. So why should we be evaluating the PPI contributors' input? And I think that you know, it is a valid argument, but I think as the years have gone on, as we increasingly expect PPI to become an embedded component of research, I think the general consensus has changed. And current perspectives on PPI evaluation, look, there are differing views on PPI out there, and without wanting to kind of polarize the research community, but I suppose we do have the kind of idea of PPI critics or skeptics, or those that are less inclined to think PPI is a good thing to do, and we also have PPI advocates who, you know, are promoting PPI and quite vocal about the need for PPI. But I think in general, most people agree on the need for stronger evidence. So the PPI critics or skeptics believe that evaluation is necessary to demonstrate the costs, benefits, and risks before they undertake anything more than a tick box approach to obtaining grants. And I think the PPI advocates then are kind of thinking evaluation is necessary to understand how best to do PPI and how to fully reap the benefits of working together. So that idea of, you know, best practice, evidence-based best practice, and ensuring that the PPI we conduct is meaningful and has a place and is justified. So again, I don't mean to kind of polarize the research community into these two camps, but in general, I think this is kind of where we are currently on PPI evaluation. An example of PPI evaluation. So this is a systematic review published back in 2018, I'm pretty sure, by Joanna Crocker and her colleagues. And this was a really important systematic review, actually, in kind of moving the evaluation conversation forward. And it looked very kind of objectively at how PPI can improve recruitment and retention in clinical trials. So Crocker and her colleagues did a systematic review, a meta-analysis comparing, so firstly identifying studies that had a PPI component and a non-PPI component, and then comparing how PPI versus non-PPI impacted on study recruitment and retention. And it did find that PPI had a positive impact on recruitment. As far as I remember, retention was a little less clear, but I do think it's a really important paper in terms of kind of looking objectively at PPI evaluation, but at the time met some criticism because of unrealistic expectations. So by setting up, you know, PPI versus non-PPI, there's this idea that all PPI then will improve trial recruitment. And I suppose kind of some of the debates at the time was that by focusing on how PPI can objectively improve research, there's also a risk of creating unmet expectations. PPI is a complex process. There's so many different ways of doing PPI, so many different approaches, methodologies, pathways to impact, that, you know, we can't, there's a risk of creating unrealistic expectations by saying all PPI does this. So I suppose it's just to kind of point out that kind of expectations versus reality kind of piece. And anyone here that has done PPI will understand that very well. Some can go really well, in other cases it's a little bit more messy and it's harder to kind of distinguish the actual impacts. And I think because PPI is such a complex process, we really do need to look at the evidence of process when it comes to PPI. And we really need to distinguish between evidence of process and then the evidence of its impact. And although these are really closely related, I think it's important that we kind of tease out the process and the context and the nature of PPI before we can even think about looking at its impact. So in terms of evidence of process, like I mentioned, PPI is a really complex activity. There's so many different ways of doing PPI, so many different PPI tasks, activities, methods, and evidence on what works and when it works and how it works and why it works is lacking. And there has been a few kind of realist evaluations of PPI that try and tease out, but overall, we don't have a huge amount of evidence on what works, when, how, and why. And although I think generally we understand that PPI methodologies have an important role in shaping the impact of PPI, current reports on suitable PPI methodologies are insufficient, really. We don't know, if you do this PPI, this will happen, or if we do, take this approach, this is the best approach to use for this. It's all quite kind of, it depends. And I think many researchers do feel that PPI is too complex to be evaluated, and it depends on too many different factors. There's too many confounding variables, if you like. So I think this is why PPI reporting is absolutely crucial, and following reporting checklists for PPI. So for example, the GRIP checklist, GRIP 2 checklist, published a couple of years ago, and I think it's increasingly being adopted, and we're seeing it being adopted quite well now in research. So whether PPI is the main component of your research, or whether it's a component that's, whether you're looking at a different research topic and adding PPI in, it's really important that you report it properly, so that those who are looking at the context and the processes of PPI, maybe those who are looking at doing, similar to Crocker's systematic review on PPI, that they have a really good understanding of, how you got to the impacts that you're reporting. So the GRIP 2 short form, there's two checklists, there's a short form and long form. I'm sure you're familiar with them already, but just to point out, this is the short form checklist. So if the main topic of your research, or the main topic of your publication is something other than PPI, and PPI is a component embedded in that, then this is the checklist that you would use, the short form checklist. So this checklist asks you to report the aim of PPI in your study, to provide a clear description of the methods used for PPI, to report on the outcomes of PPI, comment on the extent to which PPI influenced the study overall, and then kind of provide a critical reflection or perspective on PPI, including the positive and the negative effects and outcomes, and really think about reporting your PPI in a way that's helpful to those reading. So if you imagine the things you'd like to know when you're reading a study, they're the things you need to include about your PPI. There's also a long form checklist. So this is where the main topic of your publication is PPI. So if it's a full paper about your PPI process, this would be the long form checklist that you would use. I won't go through it in detail, but there's a link there if you want to access it. And the GRIP 2 checklist talks about this idea of the importance of process, the importance of context. So context is kind of looking at the conditions that are in place, whether that's funding, policy environments, institutional context and attitudes, and how process and context then kind of play into the impact. So it's not about just looking at the impact of PPI, of the outcome of PPI. You really do need to report process and context that led to that. So in terms of evidence of impact then, a lot of the evidence on the impact of PPI, I mentioned Crocker's paper earlier as a kind of an objective measure, if you like, but a lot of the evidence tends to be quite piecemeal and inconclusive. It's largely based on researchers' reflections of PPI. There are some reports of PPI contributors' reflections as well, but it tends to be quite subjective rather than objective. And these ad hoc and kind of anecdotal reports, they definitely have their place because they allow us to develop an initial understanding of PPI and how it can impact research. But because it can be so subjective, it can often kind of confuse the aims of PPI with its achievements. And there's very little reporting on the negative impacts of PPI. So a lot of the kind of anecdotal descriptive reports tend to look at, the positive impacts. You know, we did all this amazing PPI and it led to all these amazing results. And, you know, I'm a PPI advocate. I promote PPI every day of the week, part of my job. But I do believe there are negative impacts of PPI. I think we'd be very naive to think there wasn't. PPI costs a lot of time. It costs money. Without proper kind of training and capacity building, researchers can be thrown into the deep end. PPI contributors can be thrown into the deep end. And you know, we're talking about lived experience here. We're talking about you know, experts by experience, including people's perspectives, and you know, there's a responsibility to that. And I think, you know, there definitely can be negative impacts. So we don't tend to see them reported as often as positive impacts. And we also really need to consider the importance of PPI when you're evaluating PPI. So, you know, just thinking about the fact that evaluators need to be reflective about values and power imbalances underpinning PPI, not just underpinning PPI, but also underpinning the evaluation of PPI. So calls for evaluating the effect of PPI raise questions about, well, effect on what and for who? So for example, researchers might think it's really important to look at the impact of PPI on study recruitment rates. But PPI contributors might say, well, you know, before we even get to that point, we need to make sure that the research answers questions that are important and that matter to patients and patient communities. So, you know, whose perspective when we're evaluating PPI, you know, who effect on what and for whom. And sometimes researcher, well, we know often from doing PPI that what researchers feel is really important may not necessarily be the most important priority for the PPI contributors and patients and organizations and general members of the public. So it's really important when we're evaluating PPI that we actually include PPI in that process. I'm going to move on now to look at some evaluation tools. So we are moving, and in the last couple of years in particular, we are moving from those subjective, anecdotal, ad hoc reports of PPI towards kind of more objective evaluations. And I think evaluation tools have been a really important piece of that kind of process or journey, if you like. An evaluation tool refers to any instrument that can help to systematically acquire and assess information about PPI activities. Evaluation tools can include questionnaires, scales, interview guides, observation grids, organizational sponsors or external evaluators. So for example, funding organizations may use evaluation tools. And evaluation tools are important because without them, it's difficult to ensure the integrity of involvement principles and practices. So subjective reports of PPI aren't really, they're not providing that kind of neutral picture, if you like, of what the PPI looks like and the principles underpinning it. It's difficult to assess the outcomes of involvement, learn from current practices, demonstrate accountability for public investments. You know, the PPI that we conduct, largely most of the research that we conduct is funded by public taxpayers' money. Therefore, we do need to demonstrate an accountability for that, just like we do in other areas of the research process. So this was a systematic review published in 2018, again by Antoine Bovan and colleagues. And this systematic review looked at the existing evaluation tools for PPI. Now you'll note in the title here of this systematic review and throughout the article, they talk about patient and public engagement. And I'm sure you're familiar with the vast variety of terminology that's often used for PPI. Engagement in Canada, Antoine Bovan is based in Canada, so engagement is the term used there, whereas we use involvement. So this is a systematic review of evaluation tools for PPI, but the terminology used is engagement rather than involvement. So just to point that out in case there's confusion there. But the systematic review was looking at reviewing and appraising evaluation tools for PPI in research and health system decision making. They conducted a literature search of articles published between 1980 and 2016. So there's good, almost 40 years there. Databases, there was quite a few databases that they searched, including grey literature, and 2 independent reviewers then appraised the tools. And they had 4 criteria for appraising the tools. So the first was scientific rigor. Second was patient and public perspective. So this is what we were talking about a minute ago, about the importance of involving PPI when evaluating PPI. Comprehensiveness, and then usability. So usability kind of being, this was transferability for other researchers to use these tools in subsequent research. So the search terms used, and I always find it really interesting looking at systematic reviews of PPI to look through the search terms, because there are so many different terms used to describe participatory research approaches and PPI and citizen engagement and engaged research, and there's the terminology is just so extensive that I always think it's important to kind of do your own little critical analysis of the search terms used. Obviously with systematic reviews, you're always there's always that element of narrow versus wide searches, but I think it's good to just kind of scan over. So here we see search terms including, public, citizen, consumer, patient, service user, engagement, involvement, participation, consultation, partner, partnering. So, as systematic reviews on PPI goes, it's not the narrowest that I've seen, but not the widest either, if you like. So, it's just interesting to see the kind of terms that they use. In terms of results then, just very quickly, there was over 10,000 references identified, which led to 27 evaluation tools. So most of the tools were developed in the last 10 years and designed to support improvement of engagement activities. And this kind of feeds back to what I was saying about how the perspectives of PPI evaluation has evolved in recent years. 14 tools were specific to research, 11 to health system decision making, and then 2 can be applied to both domains, which is interesting actually, because I would have thought that it would be kind of more transferable between research and health system health services. Most of the tools were self-administered questionnaires and surveys. So there was 15 evaluation tools that were questionnaires and surveys. And then in terms of PPI involvement, patients and members of the public were involved in designing 56% of tools, so just over half. So we see how it's not, it's not necessarily widespread or kind of, definite practice that we involve PPI in evaluating PPI. So this is a website that was set up as part of the publication of that systematic review. And I just think it's a fantastic resource. I've included the link here. So it's a repository of all of those evaluation tools that were identified. So you can click in. I won't do it now because I've definitely shut something off if I go fiddling with my screen, but it's a repository. You can click into the link. You can click on whether you want to look at the healthcare tools or the health research tools, and they have them really neatly organized in all the different categories. So you can click into, let's say, questionnaires and see all the questionnaires that were used, how they were appraised, whether they've been used in subsequent research. So it's a really, really helpful tool for you if you're looking at evaluating your PPI, to look at existing tools that are out there and maybe using them as they are, or maybe adapting them for the context and the kind of process of your research. So that's a really helpful repository. It's there for you to use. You don't need to go searching through all the PPI evaluation tools that are out there. It's quite user friendly. And I know Emma in the next presentation is going to talk about a specific evaluation tool, the development of a specific evaluation tool as well. So I will leave it there. If you have any questions at all, I am on maternity leave now, so you can email ppi@ucc.ie and my replacement will help you out. We also have a website. That's the link to the UCC PPI Ignite website. And of course, you can follow us on Twitter as well. And I've included references as well, just if you want any to follow up on anything that I've mentioned. So thank you very much, and best of luck with the rest of the session.
Now, so huge thanks to Emmy for that excellent presentation and a really good grounding in evaluating PPI. So, you know, we're going to focus on preclinical PPI for the rest of the session, but we felt it was really important to understand and to get a kind of grasp of the fundamental principles of evaluating PPI. And now Emma will zoom in to a more specific focus on preclinical. So Emma, I'll hand to you if that's okay.
Fantastic. Thanks. So first of all, apologies, I have a bit of a cold. So if anybody has those lovely high definition speakers, apologies if there's any sniffs in your ears. Just to follow on from a couple of points that Emmy raised. So for those of you who don't know, I'm the program manager for the PPI Ignite Network at UCD. My background is in preclinical research, where I worked for about 10 years in research after my PhD, predominantly in cancer and then in the field of molecular rheumatology. So I have experience of involving PPI in preclinical research. The GRIP2, even the short form, for me, sometimes if I was writing a brief report or something that was very, you know, word count tight, didn't always suit. However, I'd really ask at the barest minimum if people could include it in keywords, because that really, really helps in some of the evaluation that we do. So even if you can't apply the GRIP2 checklist, if you would somehow either have public and patient involvement or something included in your keywords, then it helps us to pull out those papers, and actually if we're looking at any meta-analyses or anything to do that. Okay, so I am talking about a particular piece of work that I led back in 2018, 2019. So this actually came about because as a preclinical researcher, a lot of the material and resources that were available with regards to public and patient involvement, I didn't find especially applicable to the work, the research that I was doing at the time. And the Bovon paper that Emmy cited there about the different evaluation tools, a lot of those evaluation tools were not evidence-based. And that, for me, coming from the background I did, was, you know, I wanted something that was a bit more rigorous to use. So I'm going to start, rather than leave the acknowledgements to the end, I'm actually going to start with the acknowledgements on this one. So I had an excellent student, Ciaran McCarthy, who did a lot of this work. And Susie Gearan over in UCD Psychology was an incredible help as well. We had Jerry Wilson, who's a professor in chair of rheumatology in UCD. So Jackie Brown, Wendy Costello, John Sherwin, Brenda Fay, Eileen Tunney, Nicola Nestor are all public and patient involvement partners, or as we call them throughout this one, patient insight partners, who were fundamental for this study. And then we had Gerta Schumata from the School of Business and Ricardo Seguardo, who is in the School of Stats as well. So this was really a transdisciplinary piece of work that we did. So just what we were coming around, where we were coming from was that PPI is an approach to research rather than any specific methodologies. And in order to evaluate the process of what we were doing, there were kind of certain areas that we really wanted to focus on. So this is based on the fact that PPI acknowledges and values learning, expertise, and insight that comes from living with a particular experience, often in our case, an experience of a disease or a condition. And how do we show that we have actually, or how do we know that we've actually valued that experience? It's through our actions. And how do we capture that? So PPI is designed to foster collaboration between all types of knowledge holders, and that includes the knowledge that comes with living with a particular experience, as well as technical knowledge, clinical knowledge, and the other types of knowledge that we typically work with in research. And the fundamental goal of PPI is to improve research and fundamentally to improve the impact that that research has. So, as I said, it's an approach, and there are specific hallmarks of PPI. So, good PPI practice will have a two-way dialogue between the parties that are engaged. And that's really, really important. There should be able to have healthy, respectful debate. And if you're not having healthy, respectful debate, then it would imply that that acknowledgement, that valuing, that truly valuing each other as peers and as knowledge holders may not be there. It should be mutually beneficial, should be a degree of shared decision making, and people should have an active role in research. So they should be there for a reason to give their insight and not simply be sitting at the table for no reason. So some of you may have seen this before. So this is known as the Valley of Death for translational research. So we have over on this side, we have the preclinical research area. Then we have it getting into clinical trials and then actually getting into clinical practice. And these valleys here are the known areas where there is an issue of translating research across. So as preclinical researchers, what we were finding was that often if you're working on this, which you notice in the picture does not have a human, it's the only part that does not have a human there, how do we engage for the benefit of the research, the researcher and the patient? So how do we meaningfully engage at that stage? So that led us to this piece of work. So we did a piece of mixed methodology work. First of all, we did some qualitative work with researchers to help understand what their concerns with potentially engaging in PPI were. So we were able to identify those barriers, identify what the challenges were, and we broke those into different categories. Once we kind of had an idea of what the issues were, we kind of looked at how to assess those and then work towards solutions for them. And that's how this work on the evaluation survey came up. So one of the big questions we had was, okay, so let's say I do engage in PPI. How do I know if I'm doing it right? And that was a big concern that people had. So it's not something I've done before. So this was for earlier stage. This was designed for people with less experience of PPI. So how do I know if this is so different from anything I've done before? How do I know if we're doing it right? Okay, so that led us to develop this mechanism for PPI assessment. The idea with this the survey that we developed is that you can use it iteratively throughout the research cycle, which means that you can identify if there's an issue early, then put something in place. And then if you use it iteratively, you can see if whatever you put in place there has actually had any effect or not. So the idea is you identify any potential issues in your PPI relationship early so that you can address them early, and then you can help build a healthy relationship. So we had 12, as we said, PIPs, patient insight partners, who worked and helped co-design this project with us. So I was working in the field of rheumatology at the time. I'd set up the patient voice and arthritis research, and that's where these people were predominantly from. So we had 11 people who had a direct lived experience, and one person who was a parent of a child with arthritis. Okay. So we didn't just create a survey. We created a survey, and then we took the additional step of actually validating it. And that is something that often isn't done. So often people will just create a questionnaire similar to, you know, ones that you might get sent around after you've attended an event like this, for example, where it hasn't actually been validated. But what we wanted to do was make sure that there was an evidence backing up what we thought this survey was measuring. So the way we approached this was, first of all, we did a literature review of what was available. That relied heavily on a lot of the work by Anton Beaumont. So the next step was what's known as face validity. So we got this list of questions that we thought might potentially work in a survey format. They've been used in various different surveys, various different aspects like that. But did it look correct is the first one. And this is where we also brought in a lot of our patient insight partners as well. So to say, does this look correct to you? Do you understand what it's asking of you? How is the language? Is it actually in plain English? Can we refine it? And they really helped to refine those survey questions. So some of the time we would have taken questions that were identified from other surveys, but we actually refined it to make them more understandable. So we had then a questionnaire that was after this part, which was quite iterative, back and forth quite a lot with our patient insight partners. After we'd done that, we resulted in a 16 questionnaire. So what we did with that 16 questionnaire was we piloted it. So we piloted both this questionnaire and a questionnaire that had previously been established, not for PPI. It's called General Efficacy Survey, GES. And we piloted the two of them together. So the hardest thing of this was probably finding 62 people who had had experience of PPI at this stage, because it was still quite early. And in order to validate a survey, you need to have a certain amount of participants to actually do that. So what we did, we managed to find the number, and a lot of that came from, because I was in the field ringing people up or going, you worked with someone, didn't you? Can you get them in contact? There was quite a lot of work in just recruiting for that pilot. So once they had their responses in, I checked, first of all, to make sure we had enough people there, and to also look at what's called collinearity. I'm not going to go into too many of the methods, because I presume most people on the call are not from this type of research background. We then looked at, so collinearity is basically, are there questions within the pilot that both ask the same thing? So is there redundant questions in there? You know, are there 3 questions where one of those questions would do? And having done this and looked at some of the stats around it, we were able to reduce those questions from 16 questions to 8. So those 8 questions were still measuring the same thing as the 16s to the same amount. We then reanalyzed based on just those 8 questions to make sure that that the survey was sufficient, and it was. So the next thing that we had to do is look at the reliability. So internal reliability means that if you have 2 questions that are measuring similar concepts, do they agree? Because they should. And so we found that we had really good, we had more than 0.9, which is fantastic, internal consistency identified. The next thing that we had to measure was, is this survey that we developed actually measuring what we think it's measuring, or is it just, for example, measuring general confidence in somebody? So if somebody who themselves thinks are a more confident person, are they also more confident in their PPI? So that's why we had used the GSE scale, because we were then able to compare the results between our survey and this well-established survey to see, well, is it just measuring what this already does? Thankfully, it wasn't. It was measuring specifically what we wanted it to measure. And then the other one is looking at the convergent validity. And we'd added one question, which is the global assessment of satisfaction question, which is essentially overall, how satisfied are you? And the idea being that if people have generally shown satisfaction with PPI, they should also be overall satisfied. So if they should constantly be, converge, they should be showing in the same direction. And it's just making sure that it's just a statistical test that you use. So again, convergent validity was there. So that was great. We had internal, divergent, convergent validity. And that meant that we now had a validated questionnaire. So all of these are measured through a series of statistical tests that we had. And we called this the PPI Assessment Survey, or the PAS. It's a really, really simple survey. So it is the 8 questions from our PPI survey and that global assessment or survey question, the GAS survey at the bottom. So 9 questions on a scale from 0 to 10. That is it. And the key to this was simplicity of use. So if you look back at it, the idea is that this survey is answered by your PPI contributor. And you can do this on an iterative basis, be it quarterly, be it twice a year, be it after every meeting, depending on how you wish to use it. They add in their questions between their answers between 0 to 10. And in addition to developing the survey, what we also developed to make it as easy as possible to use were linked Excel files, which meant that you could send your survey to your PPI partner, and it would automatically update the responses in the researcher's Excel file. So you didn't even need to worry about emailing back and forth. And when it automatically updated in the researcher's file, what we would get is we added these flags. Because as a translational researcher, when I'm doing tests or doing assays in the lab, often this flag system is used. So we purposely took something that was from the qualitative social science space, the psychometric test, and put the analysis of it in a format that was familiar to preclinical researchers. So very quickly, even if you don't understand or don't kind of want to delve into what the numerical values mean as such, you know, okay, there might be some issue here or not. So just to go through what it means is you have the name, the email, and phone number of your individual PPI contributor. Their answers can either manually be inputted or auto-updated. The flags will auto-update. So you can see an example here is that if somebody's answered 1, that there's an immediate attention required, because seriously, there's a serious issue there. And what you also have is this one down here, which is a content validation. So what that means is that general assessment survey, the global assessment of satisfaction question, that should be in the same, approximately the same as the average of all the others. So if you're finding that this isn't the same, then there's been an issue with how they've filled out the survey. So maybe they got confused between the scale from 0 to 10 or something like that. So it just lets you know, yeah, this is filled out correctly. And that's all through one person. This all automatically happens when your PPI partner fills out an Excel file at their end. So what that does is it produces then an output table on the next tab of that Excel file. And it tells you, you input your time point, but it tells you what the overall score is. It tells you how well you're doing on communication, procedural score, and quality score. And I'll explain what they mean in a moment. And it tells you whether you kind of need to work on what you're doing in your PPI relationship. So those 8 questions weren't random questions, okay? They were designed to look at 3 specific aspects. One is information or communication. So how is the quality and clarity of the information and communication provided? That's what it's looking at. Are you taking in, is it being adequate? Are you, telling people enough information in advance for what they need? The next one is procedural fairness. And that is looking at how considerate have you been of the needs of the PPI contributor? So that's what that one measures. So in terms of even the environment and where you might be, let's say, having meetings, have you considered how easy it is for them to attend, to, if they are attending, to speak up in those meetings, to feel comfortable enough to do that? And then the last one is quality. So how valued and a PPI contributor perceives the PPI initiative as a whole. So do they think it's tokenistic, or do they think that there's actually value both for them and the initiative? And if, do I have it here? No, I meant to put one more slide in. I'll just go back, because in this format, yeah, each of these questions in the actual PAS survey has either a, it tells you which value category they are in. So the first three are communications, and then I think it's the next two for each of them. But it tells you which questions are related to those particular value categories. So why is this important? All right, so I'm going to give an example of this. So this has been updated from the average of a number of PPI contributors across the board working on a project. And the PPI survey was used every quarter over the course of a year. So you have the averages here. If you look at the overall score, it's fairly flat, right? 7 to 7.5, okay? So you can see here, because it auto-generates a graph as well for you, fairly flat. So you're thinking you're doing pretty good. However, when you break it down into the three value categories, what you can see here is that the information or communication score actually has an issue with it. So if we hadn't broken it down into those categories, we wouldn't have been able to identify this early on. So we were alerted to an issue with the communications process, which meant that we were able to take action at this second time point, which was picking up the phone, having a chat, seeing what the issue was, and then improving it for the next time. And that allowed us then to address the issue, which then, as we can see, because we continued to use it, actually did cause an improvement within how they perceived that from happening. Okay. And those graphs all auto-generate if you use the auto template. So literally all you have to do is input those satisfaction survey numbers. So, and you can either do that through the linked template, or you can have them manually send you the template and you can implement it as the researcher on your end. So one of the limitations of the survey is that it can tell a researcher if there is a problem, but it doesn't identify what the issue is. It identifies kind of a broad category of where the issue might be. However, that in some ways was purposely done because a lot of preclinical researchers aren't that comfortable with using qualitative information to derive kind of, because we haven't been trained in it, so we don't know how to properly assess it. So we figured that using a very simple way to create this flagging system, which would allow you to send an email or pick up the phone and figure out what the problem is, would actually be a more usable way to do it. The other limitation is that a quantitative method, which is what this is, can't provide that in-depth information that certain qualitative methods can use. So you might know that people are satisfied or not, but you don't know the motivations or anything behind that. But again, if you're using it as on a day-to-day use, we thought that, again, it may be more usable than some of the more qualitative aspects. So the key benefits to this is that it's designed specifically for those with little to no experience in psychometric research, so in qualitative type research. So you don't need specialist training to be able to understand what's being said here. It's open source, so it's absolutely freely available to use, as are the templates. So it takes away any need for specialist training to use it because it can auto update. And it also allows the satisfaction trends to be tracked across time and also in response to any improvement measures that you do put in place. Okay, so that is about the PPI Assessment Survey. I will send links to it and where you can download those as well. You can contact me at ppi@ucd.ie. And our website is ucd.ie/PPI. And we also have the national network website there. Just before I finish up, something landed in my inbox this morning. I knew it had been coming, but the timing was quite fortuitous. And I just like to draw your attention to it. So I have been working in the background as part of a task force with the EITRIS, which is the European Infrastructure on Translational Research, to put together a new patient engagement resource center for translational researchers. So this is specifically for translational researchers. It's literally launched this morning. So it will grow and enrich at the time, but patientengagement.eu is the website. And this you will find categories and links to various different resources for translational researchers working with. Again, the term in Europe is patient engagement. We use PPI, but very fortuitous that it arrived this morning and I could tell you all about it. Okay, I'm just going to stop sharing there.
That's great. Thanks, Emma, and thanks for sharing that off the press resource. That will be so useful, I'm sure, to everybody. So I'm delighted now to hand over to Ciaran. So Ciaran is a fantastic PPI contributor in a preclinical project. And Ciaran, you might give a quick overview of, your involvement with the team at RCSI. And I'm interested to hear Ciaran's reflections and questions as a PPI contributor, having heard those talks. So Sinead was going to take part initially, but unfortunately couldn't make it this morning in the end. So Ciaran, when you're ready, I'll hand over to you. Oh, Ciaran, you're still muted there. Oh, yeah.
Okay, we're fine. Thank you, Michelle. I am a contributor, PPI contributor to the spinal cord injury research project in the College of Surgeons, and have been for a while. And I have enjoyed the experience, I have to say. And that's my experience has been a very positive one. I haven't experienced what I know has been out there when it comes to PPI, and that's tokenism. Tokenism is not something, there's been a complete absence, if I'm to be honest, but I am only too well aware that that's not that my particular experience isn't a universal one. So that would be my first question to Emma, really. What are her views on tokenism, and how would she sort of handle it? That would be top of my list of questions.
Yeah, I mean, it's definitely an issue. And as PPI grows more and more, it is going to be something that kind of raises its head. I mean, what do we mean by tokenism? It's essentially wasting people's time, right? It's inviting people in for pretty much no reason other than to tick a box to say that you've invited people in. And that's part of the reason why I'm very specific around what's the hallmarks of good PPI. PPI isn't running a focus group. It isn't, inviting people to a meeting. PPI is practicing certain values and putting them in place day to day. And if you're not doing that, then why are you wasting the PPI contributors' time and your own time as well, and your own resources too? Identifying it and being honest with yourself is one of the important aspects. I think a lot of the time what we may have been seeing, tokenism may have been through lack of understanding, particularly when there's confusion around the terminology. What's the difference between engagement and, versus outreach versus PPI? And it may have been centered around more of a, I know I need to do something, but I don't know what, and that often doesn't lead for great success. So there's kind of a difference between those that are intentionally doing it and those that are doing it through, I suppose, failed intentions. Failed good intentions, yeah. But I think that's an important part of the evaluation process, and why you should be evaluating, specifically so that you can identify when there are issues. And it's around how people perceive it as well. So if you don't ask people how they are perceiving the interaction, you might think it's great, but if they're perceiving it differently, then that's how they're feeling, and that's valid, and you need to work on that relationship as well. So if you don't kind of ask, and you don't assess, and you don't question these things, then you're not going to be able to put solutions in place.
Okay. Another question, Emma, if I may. Timing. I'm of the opinion that PPI process should be initiated as early as possible in the preclinical work, because I get the impression that the decisions made at that stage become influential then to the clinical trial itself, and could in fact sort of be influential with regard to the direction that future work will take. So I would be of the view that the earlier the PPI process begins in the preclinical research, the better. But I would be keen to know what your view on that would be.
Yeah, I think most decisions on research happen at the concept grant writing phase, because after that, you've agreed your funding is dependent on the agreement that you put in the grant to do a certain course of work. So pre that is where there's a real richness. Lots of decisions are happening and you can get a real benefit from PPI. However, even if there hasn't been involvement at that stage, it doesn't mean you can't have meaningful involvement downstream. Anywhere that there is an opportunity to influence the course of direction of research, they are opportunities for public and patient involvement. So anywhere there's a decision being made, influence happening, the deciding on a course of action, which route to take, that is where you're having those discussions about researchers, and all those knowledge holders can be valid in it. And I think the important part is having a relationship built and established so that when those opportunities for influence throughout the research project arise, that relationship is there, so you can then bring people together because you have an existing relationship. So I think even if the relationship isn't necessarily focused on involvement in PPI, but just an awareness of what's happened and having those contacts made, so you can then take kind of those opportunities. That's important too. So even if you've missed that kind of window of opportunity, or you're unsure where you might have involvement downstream, that doesn't mean that you shouldn't be starting to kind of build up relationships as you can. And by build up relationships, I simply mean perhaps going to patient-based events, perhaps inviting people with lived experience into events that are already happening, so that people are situated together. That's where conversations happen. Most of these relationships, like any working relationships, are built on conversations. And if you don't have the opportunity for those conversations, and those relationships don't get built. So any stage really, I'd say it's never too late, because research is never linear. And very few people only work on one research project and never think about another one. We're always thinking. So yeah, I don't think at any stage it's too late.
Okay, thanks, Emma.
Yeah, I don't know if Michelle has anything on that.
No, and I think it's something that is, we're increasingly seeing and encouraging as good practice. But, for people maybe listening who are already in the middle of projects or have, projects in the pipeline, we'd also sort of say it's never too late to get started. You need to be very clear, and you might need to get some help if you're just getting started as to how to do meaningful PPI, once some key decisions have already been made. But, don't panic if you're kind of saying, okay, right, that ship has sailed to some degree. You can, know for next time to do better, but don't let that put you off, trying to, include PPI to the best possible degree in your ongoing work. Because, there's certainly huge value to be added at every step of the way. So, that needs to be the kind of future goal, but, you can think practically as well, think where you are. And then we might open the floor to questions, if that's okay with Emma and Ciaran. I know we're to time now, but just we could probably take a question or two if people had any.
Yeah. I think there's one in the chat.
Can I take that, Emma?
Sure. So Doa asks, what is the right number of persons for a PPI panel? So the first thing to state is that it doesn't have to be a panel, first of all. Okay, that is one way, but it doesn't have to be. There is no right number of persons, is what I would say. We would usually say more than one, because that builds a supportive network for the people who are involved. But this isn't a qualitative study. This is a different thing. It's like saying, what's the right number of statisticians? What's the right number of researchers? It's more about the diversity of knowledge holders. So who has knowledge that you don't? and then you bring in whatever number of those people works in your context. So that might be 2, it might be 3. For some larger projects, it might be a much wider panel. It very much depends. There is no right number as such, but just make sure that it's good practice, whatever the number is. And you can start small, you can grow when you need to grow, and you can, you know, there's no harm in starting small. It doesn't have to be a very large focus group of 15 people. Sometimes a conversation with 2 or 3 people will give you far richer information. Ciaran, do you have a view on this?
No, I would tend to agree with you. My experience has been with 2 other guys who are in similar position that I'm in, spinal cord injury people. And what I found is it works well because there's a balance there in terms of numbers anyway, with researchers and with the clinicians. So we're like 3 subgroups within a big group, so to speak. And then with Michelle at the center, and Adrian at the center, and Fergal at the center. So it's what is necessary to the process is the open communication, and it always comes back, as far as I'm concerned, to listening to each other, learning from each other, and questioning each other. If that's going on, the numbers don't really matter. The number of people involved don't matter that much, but it happens to suit our group. The small numbers happens to suit us, and the communication is very beneficial to all concerned, I would say. So yeah, I wouldn't say there's a hard and fast rule about number. No, but it just, the smaller number suits us. That's it. That's what I would say.
I agree with that. Does anyone else have a question? I know we're to time, but I'm sure we could probably stretch it in a couple of minutes if anyone had a burning question. I know Emma's provided contact details, and we're delighted to take questions. Emmy has shared contact details. I have my emails, michelleflood@rcsi.ie, so you can get me there if you have any questions. Is everyone happy? Okay, so really want to say thank you to everybody for coming today. It's been great to have the interest in the session, and obviously huge thanks to Ciaran, Emma and Emmy for taking the time to work on those great presentations and share all their knowledge with us. Okay, so thanks so much. It's great to see you, and hope to see you at future events. Appreciate your time.